We can't just hang a shingle and expect $1 million practice.
The reward isn't that great for one practice anymore. I would rather take the time and effort to grow a practice, have a low payment, and be rewarded in 2 or 3 years rather than be rewarded right away with the idea that I've got a $3 million practice.
All dentists know the common career paths, but how do you know which path is right for you, and are there other options out there?
On this podcast, we will be chatting with industry experts. We want to bring you the knowledge and resources you need to take your career to the next level and break down those industry secrets interview by interview.
We are here to ignite a revolution in the dental landscape
and help you, the dentist, build the career you have always wanted.
I'm Dr. Cassidy Reeder.
I'm Carter Frank.
And welcome to the Revolution Dentistry Podcast. Hi everybody, I'm Dr. Cassidy Reeder here with my co-host Carter Frank. This is the Revolution Dentistry Podcast where we help you with strategies to build lasting success for yourself and your family. Today we have the pleasure of introducing you to Dr. Dave Severson. He is a dedicated dentist and entrepreneur from Akron, Ohio. He completed his dental degree at the Ohio State University College of Dentistry, where he was awarded a United States Air Force scholarship. He completed his service commitment at Keesler Air Force Base. After his military service, Dr. Severson began work in private practice and grew his first group to 9 practices in 6 locations. His second group consists of 8 practices, which he owns with his co-founder, Dr. Tom Barong. Dr. Severson is also a consultant for Cornerstone Practice Solutions, a white glove practice management company that allows dentists to solely focus on patient care while Cornerstone handles the rest. Dr. Severson's acquisition and practice management expertise allows him to provide practices with the guidance and resources they need to operate successfully. When he's not at work, he enjoys spending time with his wife and their 8 children. Wow, I mean, I don't know what's more impressive, Dr. Severson, the fact that you've done all this in your career or that you have 8 children. You tell me.
Well, I think the 8 children is definitely more source of pride for me, but the work part is pretty fun. And as the kids get a little older and they start to work with us, that's even more fun.
Exactly. I mean,
Yes.
I've met one of your children. He's an absolute stud. Thank you so much for coming on here with us, Dr. Severson. We really appreciate it.
My pleasure. Thanks for having me, guys.
Awesome. Well, just to get us kicked off here, Dr. Severson, can you tell us a little bit about your background and what inspired you to step away from the chair and focus on dental practice acquisitions and management?
Yeah, thank you for the opportunity. I went to college and was pre-med. My dad is a surgeon, a retired surgeon now, and I went to school thinking that I was going to follow in his tracks. As I got a little more closer to graduation, got to be a little more serious about what I wanted to do, I realized that I really wanted to do something where I could help people. I could use my hands and use the talents that I feel I've been given, but do that with a business aspect in mind. And in medicine, what I saw when I went and followed my dad and other doctors in the hospital that he worked was you're really an employee. You're helping people, and that's amazing. We need great physicians, but you're not directing the business as I wanted to. So a good friend of mine, Tom, who's partner, his dad was a dentist, and I got to follow him around for a little while and realized that I can do everything I want from medical, helping people, getting people to wellness, that component. But more importantly, for me, I get to really work on a business in addition to helping people. So
Awesome.
that was really the main reason why. To take it a step further, though, when I got accepted to dental school, my dad said, "Congratulations, you've got about 20 years, and then you guys are going to be just like us in the medical field, where everything's consolidated." And we look at the environment now. I graduated 21 years ago, and when I graduated, I think only about 15% were in what we call corporate dentistry. Now it's well over half. So, he proved to be right. I have about 20 years, and we're racing towards what the medical field has already done.
Yeah.
That's kind of where we are and why Tom and I are trying to do what we're doing. To
Awesome.
keep it away from that corporate component.
Dr. Severson, that was an incredible background that you shared with us. Thank you so much for your story and your history. Can you walk us through your process really quick for evaluating a potential dental practice acquisition, like what key factors do you consider most critical? I feel like a lot of people, a lot of our listeners are trying to determine when would be a good time to jump on a practice opportunity. What would be considered a good practice acquisition versus, maybe another. And, if you could just share a couple of key insights on what you consider most critical when evaluating an opportunity like that.
Yeah, I think one thing you said there is when is a good time. It's always a good time to invest in yourself. Always, right?
Right.
And especially in our field. As dentists, we have a very safe, secure position, and it's pretty rare, pretty hard to drive a dental practice into the ground. So first and foremost, it's always the right time to invest in yourself if you put yourself through dental school. As far as what I'm looking for, might be a little different because of the size, but when I was just starting out, I was looking for ways when I looked at the practice that we could grow very quickly with very little effort, meaning low-hanging fruit. And so what is low-hanging fruit for Tom and I when we evaluate? If a dentist referred everything out, right, I'm going to keep my oral surgery, I'm going to keep my endo, I'm going to keep ortho, I'm going to keep that in-house if at all possible.
Right.
And I understand we have specialists for a reason. That's wonderful. I use them. I love them. But everything I can do, I do. Everything our associates can do, they do. So we keep that in-house, and we know there's instant revenue. In fact, if you really want to get down to the nitty-gritty, you can look at the number of referrals they're sending out and actually quantify the growth that you'll have in the first 6 to 12 months.
Wow.
So first and foremost, it's low-hanging fruit like that. Then it is, what networks are they in? Right? If it's a Medicaid type practice, not that those people don't deserve help, but I'm not looking for that.
Okay.
I'm not trying to find ways to overcome low reimbursements. And I understand that recently some states have really improved their reimbursements, and that's wonderful. But I'm not looking for that. I'm looking for real estate. Real estate's a very important component of the way we do it.
Okay.
And I think maybe I won't get into the depth of what we do, and I know you guys certainly know, we've shared and talked about that, but owning your real estate. I'll give you an example of why for us. We had a wonderful older dentist who about 68, 69 years old, and gave us a call and said, "Hey, I'm looking for a little help here. My practice or my building was bought, and I wasn't given the chance to purchase it."
Oh,
that's too bad, right? And he's like, "At my age, I'm not going to move the practice. I'd like a place to just come bring my patients, have a transition, say goodbye to them, and then walk away." And, as we're talking, comes out that Aspen Dental, of all places, bought his building, raised it to the ground, and put up an Aspen within 6 months. And
what?
So, how about that, huh?
That's wild.
Right? From that moment on, we've bought every building every time. We won't rent unless we control who's setting the rent and who our landlord is.
Yeah, absolutely. I mean, that's tragic that he didn't have the right of first refusal on that building. And I think that's something that you mentioned is super critical for dentists to be aware of. To be in that position is so critical when being a tenant in a space, is having the right of first refusal, so that an Aspen doesn't come in and raise your building to the ground and build one on top of that. But I'm so glad that you were able to help them in that situation and help transition those patients to an incredible facility, an incredible practice nearby. So, I mean, those are incredible insights there. I mean, I'm trying to recount the factors that you said. So you said, try and find a practice whose real estate's available for sale, try and find a practice who is referring out a lot of care so that you can keep that in-house, but most specifically endo, oral surgery, and what else did you say?
Ortho.
Okay.
Pretty
awesome.
Quick, easy one with Invisalign nowadays.
Yeah, absolutely. And then, I think, and you said one more. Am I missing something that you mentioned?
I think that might have been all I got into at that time.
Yeah, I think that's incredible. Thank you so much for sharing those insights. I appreciate it.
Another big factor that I think is the financial information of a practice. If their overhead is too high, it will cause problems of the profitability of the practice. So how would you assess the financial health of a dental practice, and what red flags do you look for in the financial statements?
Yeah, that's a great question, especially for people starting out and wanting to decide to try and invest and to not get in over their head. Um, so this is where a couple different ways to look at it, right? We can go through all the metrics and we can look at where they're too high here in supplies or lab or salary to the staff and all that. And if it's reasonable, right? And there's metrics that we can all look online and find. That's pretty standard nowadays. I actually do it a little differently. When Tom and I look at it, we're going back to the question before. Hey, if I can grow it quickly, I can catch those metrics up to where they need to be, number one.
Mm.
So for Tom and I, we are people in process over profit. If we treat the people right, if our processes, which now we've proven our processes are right, we can overcome most things. So if you're looking at a practice and the salaries, your staff salaries are 70%, you got a problem. Like, you're not going to be able to make payroll right away. So, that type of thing, you're gonna have to address if it's way too high, out of the normal range. But the other things can be addressed pretty quickly, and especially if it's your second or third office and you're starting your small group, you're going to see a reduction in your supplies immediately by joining with your group. And if you're so inclined, there's other groups like ours where we can partner together and we get benefits of even bigger groups. So there are ways to get supply costs down very quickly.
Okay,
So I'm not
awesome.
terribly worried if I see that at a very high range. We know we can adjust that and get that in the ballpark it needs to be. The bigger thing is rent, right? If they're locked into a long-term lease and you can't control that, and staff salary, how am I going to get that into the range where it needs to be?
Okay.
If you don't have an answer for that, probably should walk away.
Wow, that's really
All
it's
right.
really interesting. I feel like I've heard that you want to keep your payroll as close to 50% of revenue as possible. Would you agree with that, or?
That is standard. That's standard right now, 50%. And in rent, your lease payment, mortgage, however you want to define it, should be no more than 6%.
6%. Okay, no more. That's
Awesome.
really important. Thank you.
So to recap on that, you would say the best way to handle with the financials is to put the people first, and your knowledge when you come in there will cover the profitability itself, and also making sure that the rent is at a reasonable cost, as well as one more point you mentioned there. It was, let me try to recall.
Oh yeah.
It was
He did the overhead. Sorry, the supply, the cost of.
the cost of supply, exactly. Yeah. So those I'll say those are the three main things to think about when trying to boost the profitability of a practice. Would you agree?
100%. Yes, for sure. Right.
Awesome.
And
Awesome.
two of them are fixed, right? Salaries and rent aren't going anywhere. Those are the two that you really have to have answers for.
Right. Those are the two that if you don't know, those are the two that are critical to know, because like you said, they're more fixed than anything. And so if they're way out of range, then you'll know pretty quickly to walk away.
That's right.
Okay, awesome. Thank you. So that leads me into the next question. So location plays a significant role in the success of a dental practice. We had Tom Barong on earlier discussing and showing us a couple cases where location really affected your guys' success. How do you determine if a location is favorable, and what trends are you currently observing?
Yeah, I think we may kind of go against the grain here. I know it's safe to go into a big city and have the comfort of tons of people and assume that you can get more patients through your marketing. And that's fine. We've got practices in big cities and they're doing fine. A surprise to us over the years has been the smaller towns. There really isn't a lot of competition. Your marketing dollar goes much further than you even think of in a bigger city.
Mm-hmm.
The challenge is staffing. The challenge is finding the dentists. So you do have to find the right the right recipe of people that want to live in a small town, want to help those patients. But when you do, the reward is far greater. Our practices in smaller towns are more profitable, right? It's cheaper. It's cheaper to live there. The rent is cheap. Everything about it is less expensive than living in a big city.
Mm-hmm.
It's cheaper to purchase a practice. Everything about it. So while we're always looking, hey, can we get a dentist? We go through what we just talked about. As staff, can we afford payroll from day one? Can we afford the lease? And then if we can we find a dentist? Right? Because it's not me going in and doing the dentistry like I did at my first office or
Right.
second office. So can we staff it? There's many times where we look and we love a practice, mesh very well with the doctor, and we can't find a dentist, and we have to move on. And that's the challenge. So it's easier in a big city. You have to answer your question. I think it's easier in a bigger city, bigger metro area, near a dental school. More and more people are consolidating to metro areas the last 15, 20 years. So that's definitely going to make it easier to staff it.
Uh-huh.
It doesn't necessarily make it more profitable.
Okay, that's really important to, break down. So you've got a lot of experience finding staff for these rural practices, and what if you could give a piece of advice to a dentist who is looking to staff a rural practice, where they're looking, what would be something that's helped you find a dentist? If you could name one thing that's been like, okay, this has actually been the most helpful for us to find a dentist who would be willing to go to these rural areas, could you maybe name what that would be?
It's not recruiting. It's not anything like that. It's not having your ad in Indeed or having your broker. It's honestly it's the relationship, and it's the way you and that person connect, and it's your ability to show them that you're going to take care of them, you care about them, you're going to make sure that their salary is where it needs to be, and it's going to grow. You're going to show them how it's going to grow, and that's really all you can do. There's going to be people that answer ads because dentists do well.
Right.
But if you can't show them a pathway to exceed what they think their goal is financially, it's going to be tough for you to get them to live where they don't necessarily think is their first choice. But if you can show them that, the conversation is much easier. And then that all gets back to the first one, right? Keeping everything in-house and starting to ramp up production, ramp theirs up, and everybody wins.
That's huge. I feel like, you helping a dentist see the growth potential, maybe showing them a pro forma of what you expect could happen for this practice with all of the work that you're going to be keeping in-house that was previously referred out, that, with all the marketing that you're going to be dumping into the practice to help bring in even more patients, or maybe, an additional service like implants that it maybe didn't have before that you're planning on bringing into the office or all on X, right? And you're showing a dentist, hey, with all these things considered, we will support you in helping you pull in, the amount that you would need to feel comfortable or feel like it'd be worth working in a rural area for, right? And, having that relationship with that dentist, building rapport and trust and confidence that they feel like, you have their best interest in mind. And I think that you nailed it right on the head. I think that's extremely critical. Thank you.
Awesome. And digging more into the relationship aspect of a deal, it's your philosophy that the dentist goes first in every transaction. How do you approach building a relationship with a selling dentist, and why is that connection vital for a successful transition of ownership?
Yeah, that's a good question. I think for the most success in any practice, it is first and foremost when you sit down, they are selling their baby. They have invested their life into this. That practice has fed their family. It has taken them on vacations. It has put their kids through college, and that is like a baby to them. You just go in and it's a transaction. Yeah, I don't like this. I don't like it. I need to change this. I need to. honestly, I was guilty of when I was younger. But if you go in there and you respect and honor the legacy that they've built, and realize patients have been coming there for years because they respect that dentist. And if you start your conversation off with, thank you for the opportunity, before you even hear about me, I want to hear about you. I want to know everything about you. I want to know, because I want to know right away, is this just a transaction for them? If it is, I'm probably not going to have the most successful transition of patients. But if this is their baby, then I'm going to treat it like that with him, and I'm going to ask him, how do you want the end of your career to look? I want you to write your ending. I want you to tell me, because Tom and I and our team now are going to try and help get you that ending. You're selling for a reason.
Mm-hmm.
If you still want to do some dentistry, let's find a way to make that work. I'll bring somebody in and they'll do the bulk of it, but you want to do one day a week. You're going to cover vacations. Maybe you just have a group of patients that you love that you want to see for a couple more years. I don't care what it is. Tell me, and let's work together. And when you start the relationship like that, there's a level of trust that's gained. And it's honestly, it's immeasurable, because you are going to get them to say yes to you rather than other people, because you're doing it on their terms. So granted, we're still guiding it. It's still going to be within the parameters we need to make it successful.
Right.
But they're empowered.
Yeah. So having a simple conversation with them, having them tell you what their goals are, so that you can create the model around that to lead to a successful partnership between both parties.
That's right. And I think what you said there is very important. It's a partnership, right? They're selling. I realize that, and they do too. And they get to take more vacation time and spend more time with the grandkids. But there's still a partnership. We ask them, if this happens, are you comfortable telling your staff that you've partnered with us? Because we don't want them to just toss the keys and walk out the door. We want them to assure their staff that they've picked the right person, they've partnered with the right group. They tell their patients, hey, I've partnered with somebody. So then when they leave, the patients walking out the door, because there's always, at every sale, there's always a percentage of patients that leave, right? For whatever the reason is, maybe they're looking for, that was the moment they could or whatever.
Right.
But our percentage is significantly decreased when we get that doctor to present it as not a sale. And it is. He gets his money and he gets everything that he's looking for. But everybody else feels it as a partnership. We're not doing this to the staff. We're doing it with the doctor, for the staff, for the patients.
Right. That's huge. And I think that you've figured out the perfect way to make that transition the most favorable for not only the dentist, but the staff and the patients. That brings me into my next question, and it is about patient retention. So what are some specific strategies that you've used when working with the dentist to transition or for the sale of a practice to help with patient retention? Like you said, you guys have decreased the amount of attrition, compared to a lot of other practice transitions. How have you done that specifically?
Well, it gets more into what we were just talking about there. Specifically, it's the language, and it's our action behind the language. When that doctor, when it finally is like, okay, I'm ready to sell. You guys are the people, and then we're moving the ball down the field towards closing, and he brings in his office manager. That moment is crucial, and we actually coach them on that. We actually have a meeting before. We coach them how to say it, what to say. And if that's done well, that office manager who kind of runs everything there and keeps the gossip to a minimum, that buys, there's incredible buy-in at that point with the staff. If the staff buys in before our first day is even there, now when patients start to hear the whispers, hey, I hear doctor selling, or what's going on? Oh, he is. But he has found this amazing group, and he's going to stay here with us, and he's going to still be working with us. Like, the fear in the patients just drops. It's gone. And then when our associate comes in, and the dentist introduces him, and there's enthusiasm. The staff is excited. We celebrate the younger doctor coming in. Like this is great. It ensures our jobs are in place for the next 20 years. Patients, this dentist was handpicked by the selling dentist, and we do use what we find the dentist, but we do ask the selling dentist to give us a thumbs up. Like, hey, out of respect for you, what do you think?
Mm-hmm.
And so he's able to actually say, I handpicked this dentist. This is the right guy for you guys. You guys are in great hands.
Wow.
And he's there for 1, 2, sometimes 3 years. We had one dentist who said he'd work for 6 months, and it was 4 years.
Wow.
When you treat them the right way and you let them do what they love and you take all of the burden of management away, you know what? One day a week, and he just kind of sat in the back office, and he loved it. You got to see the patients, and his schedule is full for months. You can't get in to see the guy.
And that, what you just did there for that dentist is reignite that passion, right? That he originally had for dentistry. And
Right.
That is so incredible. And that's the power of, working with dentists who have worked so hard to build up their legacy and build up their practice, but have just gotten exhausted, right? And burned out from all of the drama, all of the difficulties of managing their practice. And, they're looking, a lot of times they're looking for help and a way to alleviate that stress that they're experiencing. And when you come in and you offer that and do it in a way that they enjoy, right? That works for them, that they know that their staff is taken care of, they know that their patients are taken care of. And you just mentioned the language is so critical, and they've shared this plan to transition with their patients, with their staff, with the appropriate language, that I'm partnering, and I found people that are incredible. And I've thought about this very hard, and I've thought about you, and that's why I've decided to partner up with these dentists, to partner up with this group specifically to do this. And I wouldn't have done it had it not been with the right people. And here I am. I found the right people for you. Everyone wins, and they're happy, and they're not stressed. They don't feel like they've betrayed anybody. Nobody feels like they've been betrayed, and they can feel comfortable to work in that practice long term and not have to stress about the management and any of those other components. I think that's awesome. Thank you for sharing.
Right. And I was going to ask you for an example of how a strong partnership with a selling dentist can positively impact a practice growth, but you just gave me one. I mean, 6 months transition goes to 4 years. That's bizarre. It's a prime example of how the relationship really matters within a deal. I was wondering if you'd mind sharing any other examples of how the relationship positively impacted a practice's growth and patient satisfaction after the acquisition.
Yeah, I can. This is a younger dentist actually who sold early, and kind of smart guy. And he said, "Hey, I don't want to be in charge of it. I don't necessarily need to make everything that the owner makes. I'm comfortable with associate pay, but I also don't want to work 5 days a week, 4 days a week." So great guy, and we had found an associate, and he ended up being able to cut back to about 3 days a week. And very happy. Well, this is where, positive impact will define positive. He had some health issues. And he had to actually suddenly retire at 40s. So by having that relationship in place where the associate was comfortable with him, he was comfortable with the associate, and the relationship that we built with him, where there's the trust, like, hey guys, I can't keep doing this. I don't want to, he felt terrible coming to us. Say, I can't keep working. My arm is killing me. I can't feel anything in my neck.
Wow.
So he had to walk away. Well, he was able to. We had everything in place for him. He felt good about the transition because he was there for the staff for a year and a half. Everybody understood. There wasn't any, like, oh my gosh, he left us hanging. Like, no, everything was set up because the transition was done right the year before. So when this happened to him, it's no problem. Everybody's covered. They can just keep going on. He's in therapy now, trying to get everything back to normal with his arm and feeling. And so, yeah, setting things up from the beginning and having great relationships, right? There's no burned bridges. There's no anger, frustration, lawsuits. There's nothing like that. It's everybody wins if you do it right from the beginning.
I love that. Thank you. Yeah, that's a powerful story. I think, you stepping in and helping somebody like that, it was so incredible, not only for that dentist, right? Because now he gets to go to rehab, he gets to get his career back on track and step back in, but you also took care of his patients. And I know that he, won't forget that. So in your opinion, what are some common mistakes, if we're talking about mistakes that potential buyers make when considering a dental practice, and how could they avoid those mistakes? Like what are some mistakes that you've seen or maybe you've made yourself in the past, and what are good ways to avoid those?
Yeah, I think it's important to not get caught up with the shiny object, so to speak. And what I mean by that is, hey, here's a $1.5 to $2 million practice. It's crushing. It might be doing better than your own practice. And oh my gosh, I can go buy this and everything will be the same. If you're not doing 1.5 to 2 million, you don't have the secret sauce to do it in a different practice. So you're going to overpay. Practice is going to drop to the level that you operate a practice at, and now you're left with a big mortgage payment, big bill, whatever that is, and you just hosed yourself because you wanted to buy the revenue, you wanted to buy, but you don't know how to actually operate it. So it gets back to, I don't know, first or second question we talked about. Hey, what are things you look for? I would look in your wheelhouse. Like, right, if you do a ton of endo, look for a practice that isn't doing a ton of endo, and you can grow it immediately. If it's already doing all the endo, you're not going to grow it too much.
Right.
So you've got to analyze ways you can grow and don't stretch more than you can. I've got a few friends that have bought too big of a practice and really regret it. And
wow.
They can barely make the payments. I would rather take the time and effort to grow a practice, have a low payment, and be rewarded in 2 or 3 years rather than be rewarded right away with the idea that I've got a $3 million practice.
Wow. That's powerful. I don't think that as many dentists think about that as they should. So thank you. I mean, I didn't even expect you to come up with such an incredible thing to avoid, but I mean, it would make sense considering the experience that you have. Thank you for sharing that.
So I guess that leads me to my next question. With the landscape of dental practice ownership changing, what advice would you give to a new dentist looking to invest in their first practice?
A lot different than 10, 15 years ago, that's for sure. I think I'd be very careful. I really would. I don't mean to scare young dentists, but you've got to have, nowadays, you can't just go hang a shingle, open it up, and be successful. The cost of goods, the cost of employment, everything is so expensive, and overhead is so tight. Inflation nowadays, it is very hard to just go open a practice if you're a young guy. So I really would. I lucked out. My best friends were dentists. They welcomed me to join them after my Air Force time, and we've grown something wonderful together. For me, that's a no-brainer. I would do it with somebody that has some experience. If you dead set on doing it by yourself, do it. You got to be patient, and you got to build it brick by brick, and you can get there. But it's not going to be as fast as it maybe used to be. You can just open the doors, take some insurances, and you're $1 million practice. Not going to be that. Your overhead is going to be very difficult to manage. That's just bottom line. It really is. So I love group practices. I love partnering with guys like me. Like people want to join our Cassidy. I know you're very entrepreneurial. Find people that have done it. Find people that are doing it, and take one piece of 10 different pies instead of one whole pie. And join groups. There's plenty of them out there now.
Yeah.
I would do that and have the comfort of a group behind me and not have all the risk and burden, because the reward isn't that great for one practice anymore.
Wow. That is huge. Thank you so much for sharing that. I couldn't agree more with you there, Dave, that having the mentorship and the partnership with somebody like yourself who has that experience is priceless. What you just shared is priceless. You know, dentists, the industry is so different. Like you mentioned, we can't just walk in, hang a shingle and be like, we're open, come on in, everyone, and expect $1 million practice. There is so much considered to take into consideration nowadays compared to 10, 15 years ago. And, you know, the age of group dentistry has arrived, you know, and partnering up with people who know how to do it right can take you so much further than if you maybe just focused on one practice that you tried just to do yourself. Right. And so the trends in the industry and being aware of what is happening and ways to take advantage of these changes is extremely important. I think you just nailed it right on the head there, Dave. Thank you so much. I think that was all the time we had for today. Thank you so much for having us, for coming on the show with us today, Dr. Severson.
Thanks for having me, guys. It's awesome.
Yeah, of course.
Awesome.
So,
well, guys.
Yeah, go ahead, Carter.
Yeah. Thanks for tuning into the Revolution Dentistry podcast. If you're finding value here, make sure to hit subscribe so you never miss an episode. We're here every week to help you grow. We'll see you next time.